everyone. I imagine that most, probably all of you are familiar, at least to some extent, with the People's COVID inquiry. So I want to just go over a little bit about why we did it, the thinking behind it, and in a sense where it's leading and what use we might make of it. And I just start with a bit of a timeline. Yesterday was the second anniversary of the lockdown in Wuhan, so 23rd of January 2020. And the following day, actually, the Lancet published a number of articles, the medical journal, saying this is a new, serious, highly infective infection, which kills a lot of people, and it's coming our way. A week later, the World Health Organization declared a global emergency. And on the 31st of January, just 8 days after the Wuhan lockdown, there was the first identified case in the United Kingdom. Now, you might have hoped that that would have given us a kind of head start, but actually nothing much happened, as you will recall, for quite a long time. So the whole of February went by. And then in the middle of March, we had the Cheltenham Festival with more than 60,000 people congregating for that. And at the same time, the Liverpool versus Madrid match with another 50,000 people mixing. We also had an early abandonment of contact tracing and testing. It was very difficult, really, to understand what was going on. I mean, I think most people thought that there were public health experts in the driving seat and that they must have the information at their fingertips. But of course, that wasn't really the case, or maybe it was the case, but they decided to go for the herd immunity idea, which seems highly likely, I think. So that there was this concept of letting the infection spread through the population, building up natural immunity, and then getting on top of the pandemic. And although there have been denials about that, the fact is that you have Patrick Vallant's YouTube interview where he's talking about herd immunity and how this will stop the spread of infection. But then some of the modelers in London said, given that the rate of infection is spreading and the mortality, actually what we're looking at now is maybe 200,000 deaths. So this was a real wake-up call. And just 3 days after that, the first lockdown was instituted. Later on in that year, bereaved families were pressing for a meeting with the Prime Minister and also pressing for a public inquiry to learn lessons as to why so many people had died. And given that the pandemic was clearly ongoing, it seemed very relevant to say, what could we do better? But the Prime Minister refused to meet up with them, actually, for over a year. Things improved in terms of spread of infection with the lockdown, but then it all came back with a vengeance with the Kent variant, or the Alpha variant as it became known, that started in November, pushing cases up considerably by December. This is around the time as well when some of the reports from the National Audit Office came out, really heavily critical of government management. One was on procurement of PPE, another was on the test and trace system. So very, very critical of the way these had been funded and had failed to deliver. And of course, a lot of the funding predominantly had gone to various private companies, and we now know a lot more about that as time has gone by. The rising case numbers led to the third lockdown just over a year ago, 6th of January. And it was sometime before that. So it was, I think, towards the end of 2020 that the idea of a People's COVID inquiry came up. And this was really the idea of my co-chair, Tony O'Sullivan, and he talked to the executive in KONP and then the steering group, and there was a lot of support. It was thought that it was going to be a lot of work, and we weren't quite sure how we would arrange it. We didn't see it as being a sort of quasi-legal process to begin with, but Michael Mansfield, who'd been involved in the campaign over the defence of Lewisham Hospital, did offer his support. And I'm very glad that we did in the end say yes to that, because it did add a lot of gravitas to the whole proceedings. And what we were concerned about towards the end of 2020, as were many other people, is how can we be one of the richest countries in the world, very good health service, fantastic tradition of public health, and yet we have one of the highest death tolls of all countries in the world. It's just crazy. And there must be really important lessons to learn that could be applied. And there was considerable pressure for the government to take on board its own inquiry, but they've consistently said for almost 2 years, not now, we're too busy. We're too busy fighting COVID. The idea that you might actually have a rapid inquiry to reset your course and learn lessons was something that I think they perceived as being politically too dangerous, because they could see that they were going to get a lot of criticism for their mismanagement. We're now in the situation where the person who's going to chair that inquiry, Baroness Hallett, was announced just before Christmas, but the terms of reference still haven't been set. And I think what we can expect is a lot of delay and obfuscation, and who knows when anything will come out of that inquiry and how useful it would be. But one of the advantages compared to our People's Inquiry is that it will be a legal inquiry, and people can be compelled to come up with evidence and to give evidence. And that's something that of course we weren't able to do. So just let me say a few words about citizens' tribunals, which is what our People's Inquiry was. This probably has its origins in Bertrand Russell's Vietnam inquiry, which was a tribunal that was based in Copenhagen and Stockholm in 1967. And it aimed to collect and publicize data about the criminal activity of the United States government in relation to the war in Vietnam. And that also provided a model for the World Tribunal on Iraq, which examined the role of the American invasion of Iraq in a very critical way. And that inquiry had a panel of advocates that were there to document the charges against the world leaders who had supported the invasion, and then what they called a jury of conscience, which were people with expertise in international law who would then assess the evidence and make pronouncements. So that this was the kind of model that we thought we could follow, albeit on a relatively small scale. And of course, we didn't have any powers as such, but such tribunals are very symbolic. There's a theatrical aspect. There's an aspect of speaking truth to power. In a way, we don't have the power to dig out the truth and find the truth, but we look at what's already out there and shine a light on it. So we bring facts that are already known, bring them to light. And it thus raises these issues to a more visible level than the government itself or the press, in fact, are likely to want to do. And essentially, it's a political campaign because it's raising the whole profile and it's asking really challenging questions, which is, how were we in this state? Who is responsible? What kind of health service do we want in the future? How important is health anyway? How are we going to reset, having been through this pandemic? Of course, the government claimed that they were doing everything possible. This is what Johnson said. We truly did everything we could, and we continue to do everything to reduce loss of life and suffering. And Matt Hancock said the first duty of government was to protect the people. Well, one wouldn't disagree with him there, but you would have to point out that they failed miserably. And of course, the recent narrative, particularly since Partygate, is to say, well, of course, the Prime Minister did a brilliant job. He got most things right with a few wobbles. And of course, he didn't. And the answer is 175,000 dead, which is absolutely shocking. The other things that we wanted to do was to have a contemporaneous account from people involved of what was actually going on, because you could see history already being rewritten. Matt Hancock was saying there wasn't any shortage of personal protective equipment. There wasn't a shortage. And of course, the famous protective ring about care homes. No, we didn't discharge infected people to care homes and then allow staff not to have PPE so that they spread infection further. We actually spread a protective ring around care homes. And of course, these are complete lies, but it's going to be more difficult and maybe of less interest to people in a few years' time what actually happened, whereas we took contemporary accounts and we've documented them. And we had the structure, as some of you will know. We had a panel of 3 very experienced medical experts listening to evidence. We had Michael Mansfield chairing the inquiry and Lorna Hackett acting as counsel and taking evidence. And I think there were 41 people who gave evidence and are on the videos. We went after some very big names like Michael Marmot, internationally known for his work on inequalities. Mike Baker, the guy who ran the response to the pandemic in New Zealand, Martin McKee, really internationally acclaimed experts. And they said yes, which was great. And we were also supported by Independent Sage, and they offered speakers, and one of the panel was from Independent Sage. We also took written testimony and video testimony. So there were some people who weren't appearing in the 9 sessions that were broadcast on Zoom, but did provide their own video testimony. So we actually have a lot of evidence, which we're happy to make available to any official inquiry. And as I said, we did approach international experts, but we really wanted a balance. We wanted to hear from frontline workers, from key workers, and from bereaved families. And I think we got a really good mix and a good balance in the end. We did invite government representatives. We didn't think they'd come, but we thought it was important to let them know what was going on. We invited the Prime Minister, Matt Hancock, to participate, and perhaps not surprisingly, we didn't hear from them. The topics, just to run through quickly, was how well prepared was the NHS, which was the first one, which was saying what sort of a state were our defences in at the start. Now, the select committee inquiry that Jeremy Hunt chaired, Science and Technology and the Health Committee, of course, they didn't look at pre-pandemic for fairly obvious reasons, as Hunt had been in charge for 5 years. They stayed cleared for that, but it was absolutely crucial. We looked at how did the government respond? Did they have the right strategy? What was the impact on the population? What was the impact on key workers? What was the impact on inequalities and discrimination? And then we looked at things like profiteering from the people's health, all the cronyism that went on. And then finally, what's happened with the continuing pandemic and how is that being met? Our first press conference in July dealt with the kind of what we call manifestly obvious findings and things which could be done now to actually reduce further infection. And they're all the things that we know about that still aren't done. So it's actually having a local-based public health contact tracing system that works and providing the support you need so people can isolate. Basic public health stuff which still hasn't been done. You know, people can't isolate if they don't get sick pay, if they've got no income, or if they live in very overcrowded accommodation. These issues have been addressed effectively in other countries' pandemic response. We then published our full report in a second press conference in December and summarized the evidence and came up with many findings and recommendations. And I don't think any of them would be of any great surprise to the people on this call. But we found that the government was very slow, that it wasn't well prepared, that austerity had undermined health and social care, and of course exacerbated health inequalities, made people more vulnerable, that planning exercises which had addressed what needed to be done in a pandemic had been undertaken repeatedly, but then ignored, and that the duty to protect the citizens' health really had been ignored in a way that in our second press conference, we said amounted, in fact, to gross negligence, because lives were lost, lives were destroyed and devastated, and this had been foreseeable and it had been preventable. Government has a legal responsibility for protecting the population from disease. Michael Mansfield cited the relevant international conventions. These included the 1948 Universal Declaration on Human Rights, the 1945 Charter of the UN, World Health Organization and World Health Assembly, international health regulations, the 1966 International Covenant on Economic, Social and Cultural Rights, which states that there's a right to the highest standard of physical and mental health, and that signatory states must take steps to prevent, treat and control epidemic, endemic, occupational and other diseases. And of course, the UK is a signatory to this treaty. So we argued that there was, in our view, evidence of misconduct in public office, a criminal offence. It means there's been behavior that's serious enough to amount to an abuse of the public's trust in the office holder and is an affront to the standing of the public office held. Because of that conclusion, we called our report Misconduct in Public Office, and we then wrote to the Metropolitan Police in the person of Cressida Dick and said we wanted the police to investigate the key players who were Matt Hancock, Jeremy Hunt, and the Prime Ministers Theresa May and Boris Johnson. We've had an acknowledgement. We're waiting for a more formal reply. I don't think they're going to be very keen on it, but it does raise the possibility of a judicial review. And we don't think this is because we'll get justice, of course, or honesty at the end of the day, but it's trying to get as much political capital as we can out of this. And just to conclude in this last minute or so, I think what the pandemic's highlighted and what our inquiry has highlighted is the special moral importance of health and protecting people's health. keeping people functioning normally by meeting their health needs protects the opportunities open to everyone. This is part of a just society, and poor health diminishes opportunities for people and is unjust. And health needs include adequate nutrition, sanitary, safe, unpolluted living and working conditions, healthy lifestyles, medical services, and social care all being available. So the People's COVID Inquiry has acted as a lens to look at all these things. And of course, the social determinants of health and why there is inequality and why some groups, of course, have fared much worse than others. And in many ways, it's an echo of what the 19th century scientist and public health person Rudolf Virchow said, that medicine is a social science and politics is really nothing but medicine on a larger scale. So I think it's opened up a lot of very important questions for campaigners and people who actually want to have a better, more equal society. It's also helped us develop a collaboration with Independent Sage, and some of you may have seen the joint charter that I think came out in November. It's on their website, where it's making the argument that services are not a drain on the economy and something which grudgingly have to be given, but they are an essential part of human well-being, how we improve people's lives, and actually are good for the economy, that we need more funding, increased capacity within healthcare, that we need to look after the staff. And we also need to have sensible long-term planning, accountability and transparency. None of these things, I might note in passing, are coming out of the Health and Care Bill, which is the current major reorganisation of the NHS going through Parliament at present. So in a nutshell, that's the background to the inquiry. I haven't gone into many of the findings because I think, as I said, none of those would be any great surprise. We do support the call for the judicial inquiry, which is now going ahead. And again, not because we believe that that's going to be highly critical of the government. There may be some criticism, just as there was in the Joint Commons Committee's report, which said actually management had been the biggest or one of the biggest public health disasters in the UK on record, but then went on to exonerate the government by saying, of course, they did wonderfully well with the vaccine strategy. And we certainly don't agree they should be let off the hook. But one of the things which a judicial inquiry will be able to do is to get its hands on much more evidence than we were able to do. And I think politically that will be useful in the ongoing fight for a better health service and a better society. Thank you very much.
Thanks very much for that, John. Excellent, as ever. Right. Have we got any questions then or comments? If people can put their hands up using the electronic situation. Okay. Anne.
Hello, John. Hello. I'm a KONP supporter as well as Zero COVID as well. Because with the government sort of ending all protections now, what can we do to protect people who have been forced back to work, who are not yet safe, you know, who may have immunosuppressed immunity or maybe at higher risk of infection and the effects? So that includes disabled people, but not only disabled people. And what protections are there for, I mean, what protections can we ask or try and lobby for those workers that are forced back into the travel that they have to take. So like on the buses and on, you know, so it's not just whether your workplace is safe, whether you've got ventilation, whether your colleagues mask, you know, well, you know, you're the expert, sorry, I'm not, but I'm speaking as a trade unionist who's really worried, and a disabled trade unionist who's really worried. Thank you.
Okay, thanks, Anne. Do you want to come back with that now, John?
Yes, probably. I mean, it's a huge question, isn't it? And of course, the pandemic is not over, and there are still things which need to be done. I mean, on most importantly, I think on an international level, is getting the world vaccinated, because you know everyone agrees that if you let infection rage in countries that can't afford vaccines, then you get variants and they then spread around the world. But there isn't the political will to actually do something about that. And it's not just waiving the intellectual property protections for the vaccine manufacturers, although our government is opposed to even doing that. It's actually setting up manufacturing in lower and middle income countries so they can make the vaccine and distribute it locally. There's this, that one of the approaches which I think I would support is that we need a vaccine plus approach. Now, the problem here has very much been that the government, right from the beginning, I remember reading their initial strategy document, and it basically said the only things which will make a difference are vaccine or effective treatment. And all the other things were really sidelined. So all the things which the WHO says is important in terms of reducing viral transmission were somehow sidelined. And it's only in the last week or so that official infection control guidance in the UK has actually accepted aerosol transmission of the virus, which is very, very slow. And even now, it's not being made clear. For example, in schools, I think it's not being made clear that ventilation and particularly viral filtering air filters are like to play a key role. So I think we have to say, look, vaccine is great, but it's not enough. We still need to, you know, if people can work from home, let them work from home. Look at ventilation in detail and look at how you stop or reduce community transmission. Now, at the moment, 100,000 infections a day, very, very difficult. But if you can drive that down, you then have the opportunity once again of having an effective test and trait system, providing it's, you know, locally based, run by public health teams, and that there is support for people who need to isolate. And then from trade unionists, I think they need to be asking for risk assessments, demanding risk assessments. They should be saying what's the evidence that the air I'm breathing is clean, what's the monitoring, what's the ventilation system. You know, we need CO2 monitors and we need the HEPA filtration systems. We need those in schools as well. And there are something like 3.7 million people who are vulnerable for various reasons, and they're just being completely disregarded, given that we're now encouraged that we can all return to normal. You don't have to wear masks, and I think people should still be wearing masks indoor places, in shops, and when mixing indoors. But I think from a trade union point of view, the ventilation and the clean air as a right under the health and safety legislation is something which really needs to be taken up and addressed. There's something on the TUC website, Hazards Campaign also being involved with that. Doctors in Unite also produced a document for health and safety reps on ventilation. Okay, so that's it. Sure, there's lots of other things that people want to say about that.
Okay, thanks, John. Claire and then Kerry.
Yes, thanks so much, John. I mean, that's music to my ears, all that. I'm a retired occupational physician, and so my big question was quite similar to Anne's. why on earth, is the government not putting in population protective measures? And those that you've described, I think, are absolutely essential. Where do we go from here? Because quite clearly they need to be put in, and they're not going to be. Vaccine on its own is not going to get rid of the problem at all. I don't think. I think it's just as vaccines stand at the moment, and they're fairly low down on the hierarchy of protective things. And I think we've got to drive down community transmission more in the ways you've said. So yeah, where do we go from here, faced with this still lack of protection? And I just also wondered, as a retired paediatrician, your feelings about the way children have been left entirely unprotected, because I cannot get my head around that.
Yeah, just on children, there was a lot of argument about the risk benefits of children being immunized, but they've turned out to be a way of promoting spread of infection in the community. And I think because there has been widespread immunization of primary school children in America, I think we can say it's safe. So personally, I feel it's definitely the right thing to do, and that we're just lagging behind there. Fortunately, as you know, children generally don't become so ill, but now we've seen quite a lot more admissions in the very young age group with Omicron, and there have been about 80 deaths in children in the UK, and it's been estimated that there may be something like 70,000 children who are suffering from long COVID, which is a huge issue. So I personally, I'm in favour of vaccinating younger children, and I obviously agree with your other comments. And I think one of the things, when we were thinking about how we use the People's COVID inquiry, the sections stand by themselves really. So there's one which is very much about the protecting frontline workers and health and safety. And Raymond Agius is a very preeminent occupational health physician who you all know.
I know him very well,
was one of the witnesses there. And we're keen to share that kind of stuff with trade unionists, and also to build on it. And I've been in touch with Raymond recently about how can we take things forward. For example, pressure to have COVID-19 recognized as an occupational disease in a way that it isn't at the moment.
I would be very happy to help out in any way that I could. I really would. So thank you.
Thank you, Claire. I'll make a note.
Brilliant.
Okay, thanks for that. Kerry, and then Rosamond, and then Gary.
Yeah, hiya. I could have put this in the chat, but I thought I might as well talk about it because it's kind of up for discussion then. I'm not a medic at all, but I've been a volunteer with the Sheffield Community Contact Tracing Group, which was set up by retired doctors and public health officials, which I think probably people know about. And they set up a pilot project doing contact tracing. And then our director of public health, kind of when the crap Serco contract came in, said it was too confusing to the local one running alongside the national one. So we had to put our kind of skills to different uses. But I'm a trade unionist, I'm in Unite Community, and I'm a delegate to the Sheffield Trades Council. And Jack Chowderner, who's a retired GP and one of the founder members of Sheffield Community Contact Tracers, is bringing that Doctors in Unite motion to the Trades Council tomorrow, and we'll be speaking to it. And it is the vaccine plus, it's the whole raft of preventative measures. So it's pushing our Trades Council, which is a very active Trades Council, and has got a lot of reps from education sector, schools and higher education as well. And the schools were very good, weren't they, in terms of bringing pressure to bear on the government. So hopefully we're going to be pushing that through. But I think if you look on, I haven't looked it up, but if you look up Doctors in Unite and look for that motion, it is the one that you can bring to trades councils if you can, or at least kind of use the text within it to kind of frame what your arguments would be on people that you feel that you can influence. But just to push, I picked out a book the other day, which was written by 2 Sunday Times journalists. It's Arbuthnot and I can't remember the second guy's name, Culver, I think. And it's called Failures of State. And it follows, it's 400 pages worth of terrifying mistakes that the government made. And they've had so many whistleblowers and named people that have talked to them. And it covers from late 2019 in China and runs up to this time last year. It's really worth a read. Cheers.
Okay, thanks for that. John, do you want to come back with?
Well, no, thanks very much. And of course, we had one of the fantastic Sheffield contact tracing team as a witness in the inquiry. And the model motion is on the Doctors in Unite website, plus the document that's been put together for really aimed at health and safety reps over ventilation. So you can find those on the DIU website. And it's a very good book, so I'd recommend that. And I also like the one by John Ashton, which is shorter but a good read. It's called Blinded by Corona, and some of you, particularly in Liverpool, will know John Ashton. Okay,
thanks. Rosamond.
Thank you. What brief answer can I give to people who keep asking me why I'm not going out? I mean, with no masking on public transport or crowded public places, even quite sensible people, vaccinated and elderly, seem to me to be going bonkers. I don't have cancer, but I do have low immunity. And I am quite concerned, but I don't want to seem hysterical. Is there a very brief answer I can give them? Look at the figures and behave yourselves.
I mean, the figures are there for all to see, but they're not really given as much prominence as they should. 100,000 new cases a day. Do you know how many people are dying from COVID at the moment? This is an average. It's one person every 10 minutes.
Oh no, that's brilliant, because I thought it was about 90,000 had died, but that's very good.
Yes, but since September, the line is fairly level since September. Then it's I worked it out earlier on, and the average over the last few weeks, and actually it reflects pretty much over the past 4 months. And it works out as six people an hour, so about 140 people a day on average. That's a very striking statistic, I think.
Brilliant. Yeah.
And that's what I say to people. And so people, someone again told me yesterday, well, COVID is just a cold. What?
Yeah.
How many people die from colds each hour?
No, 6 people an hour is brilliant. And are they mainly vaccinated or unvaccinated? Because that's the other thing when people talk about vaccine, you're only endangering yourself, not others. I want to say no.
I don't think, I'm not sure that we have that data. We have some data on patients in hospital who are vaccinated and unvaccinated, and that's being quite contested. But at one point, it was about 60% of people on intensive care were unvaccinated. But even if, of course, you had two vaccines, you weren't very well protected against the Omicron. But I think the problem is there's a lot of it about. And it's not just getting seriously ill and dying, it's also long COVID that's a considerable concern, because this is not for everyone. This is not just a trivial illness. It can have very long-lasting implications.
Yeah, no, I know a couple of people who got long COVID. It's very unpleasant. Thank you.
Before I've been going, I could just come in with something else as well. I think that as well as one person dying every 10 minutes, which is absolutely horrendous. I mean, if you don't think that's bad enough, the fact that people are going to hospital and they're already putting pressure on a massively pressurized NHS as well. And I've heard people say, "Oh well, it's okay. You just spend 2 or 3 days in hospital. Well, you know, I don't particularly want to spend 2 or 3 days in hospital myself, but you know, it's the pressure as well. Put, you know, obviously put on the NHS, particularly in a situation where we've got massive cuts, 90-odd thousand, shortage of staff, all the things we know about as well, really. Okay, Gary.
Yeah, regarding the person actually, that I'll see if I can try and help you a little bit here regarding the going out and about. I'm visually impaired and I'm also looking after a clinically vulnerable relative. Now, what we do is wear PPF2 masks to go out and about, because the PPF2 and the PPF3, if you can afford them, they're not cheap, they're quite expensive, is the way to go, because that will help you in a lot of ways in indoor settings. So I hope that sort of helps with people wanting to go out and feel that they could well be restricted and staying in for days and weeks and months on end, because you've already done that and your mental health's already suffered vastly because of that. So that's hopefully going to help those. My actual question is to John, how does he feel regarding the mandatory vaccinations that have come out, especially now in the NHS, which like threatening to sort of lose 73,000 workers who are mainly BAME in the main. We've also already had it in the social care sector. I'm wondering what his opinion is regarding that.
Oh, thanks, Gary. John?
Yeah, I mean, just on the mask point, I think that's a very good point to make, actually. You can get FFP2 masks. I bought one. It's washable, so you can reuse it. It does give you a little bit more protection. Mandatory vaccination, KONP doesn't have a position on this because people argue over it. Personally, I'm against mandatory vaccination. We don't have mandatory vaccination in this country, and we respect people's autonomy to make a decision about treatments. We also know that 90% of staff are vaccinated, and I would like to think that most of the other 10%, if you could sit down with them and address their concerns, that they would become vaccinated. So I think that's the way you do it, and that's been a very important principle of public health in this country ever since we had public health, apart from when there was compulsory vaccination for smallpox in the 19th century. And then because of public opposition to that, a law was passed saying that it wouldn't be mandatory any longer. So I think it's much more important to persuade people. I think it's tragic that there's going to be people who lose their job. There are difficult issues like, of course, being vaccinated doesn't guarantee that you can't have the virus and pass it on to vulnerable patients. It isn't a guarantee in itself. And it may reduce the risk, and I accept that, but it doesn't guarantee that you can't infect others. So I think it should be done by persuasion. I think it's very bad. We've had flu immunization in the NHS for, I don't know, 15 years, offered to all staff, and people are encouraged to get it. It's not made mandatory, but you have it for exactly the same reasons, not because it's going to stop you dying, because it's going to stop you giving the infection to vulnerable patients who then may die of flu. People sometimes say, yeah, but doctors have to have hepatitis B immunization. Well, they don't. There are health and safety requirements, which means if you carry that virus, then you can't do things that might infect patients. So it does have implications for how you work. But there isn't a legal mandatory obligation to have that vaccination. Otherwise, you're sacked. So that is not a precedent. So that's my view.
Okay, thanks, John.
Okay, John, thank you.
Okay, Cynthia.
Thank you. Yes. It's a small point, just picking up on things that have been said, really, but thinking that the government are always cost-minded, you know, the cost to the economy, if we keep on doing this, that, and the other. I wondered if it's possible to point out the ongoing costs to the economy and the health service of all the people who are getting long COVID, which if it's like ME, it could go on for, you know, a long, long while. And also all the costs in personal discomfort, pain, but also probably economic costs for all the people who are still waiting for their operations. You know, that this strategy of theirs has a lot of hidden costs, I think.
Okay, thanks, Cynthia. John, do you want to?
Well, I think that's a really important point. If you did do a cost analysis, it would be it probably wouldn't go the way that the government suggests, because there are these huge hidden costs, and currently hospitals are estimating that the extra cost of dealing with COVID is about 4 billion a year. Now, the government, of course, says, well, we've given record funding to the NHS, but they're giving 15 billion over 3 years. You know, this is peanuts. It's barely covering the cost of being able to manage COVID, let alone replace outdated equipment, build up staff numbers, deal with the backlog and what have you. And I think the economic experience in other countries, of course, is and there's been some good reviews of this, is countries that went in hard early lockdown, controlled spread of infection, actually they ended up doing much better in terms of death rates, but also economic performance. And that should have been a lesson for our government. At the moment, they're equating not having restrictions with having a flourishing economy. But I think that may well turn out not to be the case longer term, for the reasons that Cynthia that you mentioned.
Okay, thanks, John. Tazy.
Thanks. Yeah, I just wanted to chip in on the mandatory vaccinations for health workers discussion, because I think that it's quite sensible in a way that Keep Our NHS Publlic doesn't have a position on this, because I think one thing that really can't be ignored about how this issue is going down is that the anti-vax movement is like completely dominating that whole debate. Just 2 days ago, there was a very large demonstration in London, including health workers. I don't know if there were some people there maybe pretending to be health workers. I would not put that past them, but presumably at least some health workers. And, you know, like there's very anti-Semitic signs. It's that organization, the White Rose, is involved. And these are large demonstrations. They are a similar size to the demonstrations that were happening around the pay rise, I think. I could be wrong about that. But I think it's an extremely worrying thing we're seeing happening, where a small section of health workers are being won over to the wrong articulation of the opposition to the mandates, which has this anti-vax core. And so I think that it's a really huge challenge to how to articulate the like left-wing, like workers' rights position against the mandate. I think unions are doing a good job. There's a new open letter that's just been launched by health workers that I can share in the chat for people interested in that. But I think that context has to absolutely inform how we engage with that subject, because that's what's happening, is this big like anti-vax and the seizing on the anti-mandate thing.
Okay, thanks, Tazy. John?
Well, no, you're absolutely right. Unfortunately, it is being hijacked by the anti-vaxxers, and some of you will have seen that anaesthetist interviewed on the telly was the one who tackled Sajid Javid in the London hospital and said, "Well, I'm not vaccinated. I'm not going to get vaccinated," and then tried to justify that on scientific grounds, but actually just got his facts wrong. But that's gone viral, I think, and promoted by anti-vaxxers. It's very unfortunate. So the letter you're referring to, I think, is the one, I think, that says we are pro-vaccination, but we're not pro forcing people to do it. And actually, if you think how much care the government have shown for frontline workers, you don't replace them, leave posts empty, and huge stress from the workload pressures, and you don't give them the right PPE, and then you penalize them for, you then blame them for spreading the virus because they haven't got vaccinated. With trust and patience, I think there's ways to persuade all except the very, very small proportion of people. But this government doesn't have a lot of trust. And, there are segments of society who understandably have very little trust in authority and the medical profession and government. And it takes time and making an effort to win them over and persuade them. And these are not, I'm not talking about anti-vaxxers, because I think they're nuts, but the people who are vaccine hesitant because they have questions that need answering. I think they make up the majority of the people who haven't been vaccinated in the health service and the care sector.
Okay, thanks for that, John. Isabel.
I just wanted to ask John, I may have missed the answer to this in your talk, but you gave a very impressive list of articles of international law that the government was contravening. And I wondered if there was any way of taking them to court over that. And one suggestion would be maybe partnering with an organisation like the Good Law Project. I mean, I know you at KONP can't just, do everything. And you've got limited capacity, but hearing all those articles of law that they're flouting just makes me think, well, why can't we do something about it? And I just wondered, is there
a great point. I mean, what I said is that the conclusion of our inquiry, which gave its title, was that there had been misconduct in public office, which is a criminal offence. And we have written to the Metropolitan Police and put this to them and said, we think there is a case to answer and that they should mount an investigation. Now, clearly they've been very reluctant to get involved with things like the Partygate stuff. I can't see them taking this on, but I think that who knows, they might do, not very likely. If they don't, then there's the possibility then of a judicial review, which would probably be focusing on whether they had given due weight to our representations and had gone through the right process in terms of assessing it and coming to a decision. But at any rate, that's what we're lining up for. The next stage, we'd be looking very much whether it was possible to have a judicial review to challenge the Met over saying they weren't going to pursue a prosecution of misconduct in public office or corporate manslaughter.
And for the uninitiated, what exactly is a judicial review, and what consequences, if any, can it have?
Well, a judicial review is going to the courts and asking if things had been done properly. And for example, the Good Law Project took the crony contract issue to the for a judicial review, and the finding was that the process had been illegal. Now, the judge very unhelpfully said, but they would have got the contracts anyway, which is crazy and says a lot about the dreadful state of procurement in the government, on the part of the government. But that was illegal. Another one that the Good Law Project did early on was over Matt Hancock not releasing details of contracts which had been awarded to private companies, within the specified time frame. And again, the judge said, yeah, this is illegal. There are rules about these things and they haven't been followed. It's illegal. So the government got their hands slapped. And over the contracting, I think it makes it a bit more difficult for them to get away with it. It might not change things completely, but it's all about transparency and shining a light on the dark places. So I think if, for example, and I'm jumping ahead a lot, but if there was a judicial review because the Met failed to follow up our invitation to prosecute these very senior people, then that they may be found at fault. That process that they used to decide not to do it, they might be found that they'd behaved illegally, and then they'd have to think again.
Okay, thanks, John. Carmen, and then Anne.
Thank you. Yes. Yes. Going back to the relationship between the mandation, the mandatory vaccinations, and the connection with the anti-vaxxer movement, would it be fair to say that the more the government takes a polarizing position with mandatory measures, the more a country, like happened in Austria, is divided between those who are vaccinated and those who are not, and ordinary rights are taken away from the unvaccinated. And the more we use these kind of methods instead of what the letter from the unions emphasized today, the conversations with the vaccine hesitant, the gaining their trust, the fact that even 64% of the population over 12 years old have had the boosters. Now, that means there is an awful lot of low-hanging fruit there, people who have had the first vaccine, the second vaccine, and yet they haven't got the booster. The government could be doing loads and loads of persuasion work, promoting vaccines in a positive light and in a much more, in the end, efficient and effective way, rather than blaming the individuals, which is what they've done in everything. That's why we don't have public health measures, because everything is left to the individual. And dividing then the individual that chooses to with the individual who chooses not to vaccinate, and putting in the same bag everybody there. We know the anti-vaxxers are an extreme case, and I really don't want to spend any time on them. I'm talking about the very, very many, the majority of people who are not vaccinated are not anti-vaxxers. And the more we go that route of mandation and division, the more you polarize the hesitant, the more you polarize the person who can be persuaded, and they are moving and finding alliance with the anti-vaxxers, because you attack somebody, they're going to attack you back. It's just the way I see it, and I wonder if there is any logic in that. Thank you.
Well, I agree entirely with that. I think it is one of the arguments against mandatory vaccination, that it's just music to the ears of the anti-vaxxers that the government are taking away freedom of choice and forcing people to either have a vaccine or lose their livelihood. And I think that hardens attitudes and makes the whole thing more complicated. So I completely agree, and I think I understand why some people say we can't have staff infecting patients, that the staff have a moral obligation not to put patients at risk, and I understand that. But there's also all these other issues, including autonomy and civil liberties, I think, and not reinforcing the anti-vaxxers and all the negative consequences that has.
Okay, thanks, John. Anne.
Two things quickly from that, and then I'll go back to my other question. In informal discussions at TUC, we're looking at how far the far right narratives are driving the anti-vax movement, and whether I wondered if you have any thoughts on that, John, relating to how mismessaging is being communicated. So the sort of generating of the fear through the social media and stuff. And then the question I had come was just before this meeting, I read that Lord Agnew, the Treasury Minister, in the Lords had resigned because he hoped it would be over the corruption over the contracts for the COVID. Sorry, I'll get it all wrong, but you probably know what it is. And I wondered if that was, he said in his statement in the article I read that he hoped that this would lead to greater greater examination, or sorry, I'm a bit flustered, greater public greater scrutiny. Sorry, I couldn't get the word. And I wondered if you had any thoughts on that. It was just before our meeting, so
yeah, I haven't. I saw a headline somewhere, but I haven't sort of caught up. But if he's resigned, he's setting a good example for some other people who should be considering their position, I think. And the far right are clearly very tied up with anti-vaxxers, and I'm not an expert. I don't think I can comment, but it's the people who are very divisive and very mistrustful on the periphery of political debate very often, that are using the vaccination as a way of further alienating people, and it's quite an extraordinary phenomenon. But yesterday I read that 12 million Americans think we're ruled by a race of cosmic lizards dressed as people. And apparently David Icke thinks that the Queen is one. So there's lots of weird stuff around, but there is definitely a very worrying tie-up with the far right politically. Yeah.
Thanks, John. Mick.
I actually am in favour of vaccine mandates. I think you said the last time we had one in this country was for the smallpox vaccine. The global eradication of smallpox is viewed as the greatest success story of public health. And that was why we had a mandatory vaccine. I just don't understand why we're in the situation where we went, yeah, that worked really well. Let's never do that again. I just wanted to speak in favour of mandates.
Okay, I mean, I appreciate the argument. Of course, it wasn't mandatory vaccination of smallpox that led to its eradication. So I think mandatory vaccination of smallpox was very effective in some places, like Russia. It was introduced by the Bolsheviks. But then I think there was a government that people trusted and felt ownership of, and that's a rather different situation. But internationally, smallpox was eradicated because of standard public health processes, not through mandating everyone that they had to be vaccinated.
Okay, thanks, John. DMCD.
Hi there, thanks. Just a couple of little things. John, I think, said that vaccination doesn't stop passing on the virus to others. I'm having great difficulty persuading people of that. What's the medical evidence for that, or what evidence is there from the WHO or whoever? And the other thing is I'd be fully in support of mandatory vaccination if it was across the board. If we all had to be vaccinated, that would be fine. Picking out one group whose jobs are vulnerable in particular, I don't think it's fair. So yeah, what's the evidence for vaccination doesn't stop you passing it on?
I can't off the top of my head give you a detailed chapter and verse, but it's very well recognized in the medical literature, and a lot of the discussion, debates, and the monitoring of what's happening with immunization programs that people can still transmit. Can anyone else help me out here? Like Claire or David Church, if he's still on the call, who's a GP? So
I
there's
can't, sorry, carry on.
no, you carry on.
I was just going to say, like John, I can't sort of produce facts and figures on that, but it's very well known and very well researched that you can still pass infection on, and indeed you can still suffer it several times. So if they were vaccines that did really push the level down, then I think that would be a different matter. I'm not saying I would agree with it being mandatory even then, but it's well documented and well studied that it just the edge of it.
In my experience, it's certainly not well understood by the general public.
Okay.
No, I think that's true, and it's partly because of the way things are presented by government, always as very black and white. You know, it's like lateral flow test, 100% accurate in telling you whether you have or haven't got infection, which is complete nonsense. And I hate to think how good the lateral flow tests are when they're done by people at home. You know, the Liverpool study where they compared them with the gold standard PCR test. If you had an experienced nurse doing the lateral flow, it picked up 72% of the infections. If you had someone working in the lab doing it, picked up 52%. If it, in the general public, it's got to be lower than that. And it missed 30% of people with high viral loads. And yet you have Boris Johnson in Hansard telling you these tests are absolutely fantastic, because if you have a negative result, it means you haven't got the infection and you can happily do whatever you like because you won't infect people. And things are always much more complicated than the politicians in particular like to believe.
I absolutely agree, Mick. It's not well communicated to the public that is the case. It's not communicated at all. It's vaccines are magic. They're going to get us out of it, and that's the only thing. But yeah, so I agree.
Okay, thanks. Jared, and then Joan.
Yeah, hi. Just following on from a meeting a few weeks back, with a guy from North America. He was talking about a Citizen Science project, rather like Chris Lintoff, the Sky at Night fame, as introduced in astronomy. I think we need something rather like that, Citizen Science project, in order to dispel the disinformation that's still rife in society today. I was listening to a guy on Radio Merseyside this morning who was saying that it's just like the flu or a common cold. Otherwise, it doesn't exist on a vast scale. It's not killing people really. It's only a myth. And I think people like that ought to be put down, really, to be honest with you. But I think people like that we ought to combat that by getting some real science, the real facts out there. I don't know how we do that, but it's perhaps something we can look at in the future.
Okay, thanks, Jared. John?
Yeah, 2 points. One, in terms of the transmission from vaccinated people, I'm clinically extremely vulnerable, and therefore I continue to shield. And therefore my attitude to other people, whether they've been vaccinated, may not be scientifically accurate. I understand the science, but there's a really, really strong psychological effect on the person who is vulnerable if somebody who has not vaccinated either comes in their house or, I mean, the worst case is treating them or caring for them, especially people who are carers domiciliary carers going into people's homes. And there is a real, even if you tell them 100 times, you will not catch it. You could catch it just as easily if they're vaccinated. There is a really, really strong psychological effect that makes you think, I am safer. And one of the things I've experienced certainly is people who, there's two levels. One of those who just say, I don't need to get vaccinated, I'm healthy. But those same people are not wearing masks, right? So even though they're not dedicated right-wing anti-vaxxers, in fact, the people I know are dedicated hippie anti-vaxxers, they are also the ones who think that they are not passing on to anyone. And that is a real problem, that you kind of getting that gulf between, it's not just about vaccination, it's about you caring about your community and caring that COVID is real and that you could pass it on. That I don't think we're getting across. And the trouble is the anti-vaxxers are also anti-mask, and they are spreading their propaganda all the time. And when they do have major big marches in London. Those are big marches which are very, very close together, tightly packed and unmasked. And so people who may normally think, oh, I'll wear a mask on the tube, think, oh, well, I'm safe and I won't wear one. So I think there's a real problem that is not about the science, but is about how society works in terms of trying to persuade people in terms of vaccination. There are lots of people, particularly young people, who again think that they're safe, it doesn't apply to them. And they are the people that have to be persuaded. They're the people we have to go. Everybody, it's not just the government, it is the NHS, has to go out of their way to find ways of persuading them. I mean, the early stages of the vaccine, when they were doing vaccinations in nightclubs and things like that, and youth clubs, that's how you have to get to some of them. But I do think the issue is in a way, it's not about mandating or not. It's about persuading on a level that applies to both those people who feel vulnerable as well as those people who need to get vaccinated for our safety, that it's not actually about individual choice. It's about collective safety and public health. I think we need to get across. My other question to John, which he may or may not know the answer to, I'm presuming, because this is what happens all the time, that an awful lot of research is going on to develop better vaccines. I mean, certainly AstraZeneca, although it's not the best one of the lot, we know that now, was developed in terms of how you do it within a day, and it took another year to get into manufacture and spread around. But I'm presuming all around the world there are brilliant scientists doing that kind of work. And do you know how much do we know about that? I mean, presumably they're not telling too many people.
No, I think there is a lot of work going on. I mean, I was reading about one in one of the American children's hospitals where they're working on one that would be easy to make. It doesn't require to be kept at very low temperatures, and where they're not going to patent it because they say that they're about producing something that could be used widely.
Yeah, I saw that, yeah.
So that I think there's probably, I'm sure there's other groups that are working on vaccine development. I don't know much about it, but I'm sure if you look online, you'd find quite a lot. And Jonathan Pye's just posted a link in the chat about a letter in the Lancet about viral transmission or viral carriage in people who are immunized and those who aren't.
Okay, thanks, John. Gary.
I think one of the problems we've got here is the fact that, as the lady's just mentioned, that she's CEV, and like how long do these people stay indoors and isolate? They could be going on forever, until this is rectified and mitigation protections are put in place properly. We're never going to get to the bottom of this virus, because we're just literally carrying on, and in the end we get mutations and variations of the virus, which could possibly be worse than Omicron or less so. And then we've got people that are vulnerable and extremely vulnerable or CEV, and this could be going on, as I say, indefinitely. So how much longer does that poor lady have to be indoors for before she can come outside again? Really, this is what gets me really with the whole pandemic now, really.
Okay, thanks, Gary. John.
Well, I mean, it's a depressing thought, Gary, isn't it? I don't think we know the idea. I mean, what do I hope for? I hope that there'll be a government that wakes up and realizes that vaccines are just part of the response. And I think there's enough evidence already for them to do that, but they're in a state of denial. But when the next variant comes along that's even more infective and maybe makes you even iller, then perhaps things will change then. I think with it just going on, it'll force a reappraisal of the approach, and I'm hoping that international pressure will also lead to a much more serious and effective international response in terms of sharing vaccination. But how long does all this have to take? You know, that we know already. I mean, the WHO will tell you what needs doing now. Governments aren't doing it. They might do eventually, but only when it's clear that many more people have died, the economy's been further damaged, that society's been further damaged, and there really needs to be a big change in approach in this country. That's probably a change in government, but even then, I think the Labour Party have been very passive in terms of not criticising the government over their incompetence and inadequacies in terms of pandemic response.
Okay, thanks, John. Isabel.
I think we need to get across the message that the Vaccines Plus approach and the public health measures that we're recommending are going to keep society open, not lock people up, because our opponents are always saying that we want to just lock people up and we want restrictions, and you know, restrictions will be lifted and then we'll all be fine. But you know, the public health zealots want to impose restrictions. But what we really want to do is put ventilation improvements and protections in public buildings so that people can go into the public buildings. We want to give people free masks so that people can wear the masks and protect each other. We want a test and trace system so that transmission rates can be kept low and the people that are carrying the infection can go into quarantine, and the people that have been in contact with them can go into quarantine as well and can be supported to stay there, so that people who are in circulation in the outside world are far less exposed to the virus. And that's what's going to keep society open. And that message seems to be so hard to get across. We're up against this kind of wall of denial and myths, whereby, you know, the only alternative to this let it rip approach is a big lockdown, and that these kind of communists want to send everyone home. But you know, the opposite is the case. Having this virus circulating at such high levels means that lots of people have to stay at home. It's so difficult to communicate, but we really must persist because, you know, common sense is on our side. And then I just wanted to say one thing which I hope will encourage us all, and that is that there is, I believe, at the moment, a meeting taking place among some United Nations bodies about WHO funding and how that can be increased. Because one of the reasons why the WHO can't put its messages across is because it hasn't got enough money. And that is, people are trying to change that now as we speak. You know, these things might speed up behind the scenes and might make a difference to us in the UK and to everyone else, of course, as well. So let's not, you know, think that nothing's happening, because some things are happening and there is a bit of hope on the horizon.
Okay, thanks for that, Isabel. Have we got anybody else want to speak before I bring John back in? Okay, I just something which come to my mind as well is the contrast with the situation in other parts of the UK. I'm thinking particularly about Wales, for example. I don't live far from Wales. I've been over there a couple of times, and it's quite different to the situation in England in terms of, well, it has been different in terms of signposting, mask wearing, ventilation in public buildings, and so on and so forth. You know, the contrast is quite considerable, really. I know Mark Drayford is starting to lessen that now, but certainly, you know, it's been markedly different. I think similarly in Scotland as well, but I'm mentioning Wales because I know a bit more about it, really. Anyway, John, over to you. Yeah.
Okay, well, thank you very much for a very interesting discussion, and also the invitation to me to speak. And I don't really want to say much more, except to absolutely agree with Isabel's final comments there, that measures to reduce viral transmission is actually how we keep society open and functioning and avoid lockdowns. So how you get this over to people is really important. And I think, in a sense, that's one of the things which the People's COVID inquiry wanted to do, but of course time has moved on. But rather than the inquiry findings becoming less relevant, they've actually become more relevant because of the lesson that Omicron has taught us. And there is a lot more that needs to be done, but we have to keep making the arguments. And I like the idea of people's science. We might need to have another people's COVID inquiry, but let's hope not. You can order the inquiry summary from the KONP website, and we will be producing a full paper copy. At the moment, you can download it on the net, but at some point we will be printing off some full copies, just because some libraries and some individuals want to have a full printed version. But when they're available, we'll let people know via our website. What else can we do? We have to fight for the NHS. This is all about fighting for the kind of comprehensive health service that we want, given the importance that it deserves. And so the next big date in the diaries is the 26th of February for the SOS NHS campaign. And I'm sure you're all going to be out there, unless you're having to isolate at home on the 26th. So thank you very much.
Thanks for that, John. Excellent as ever. That was really a really good discussion, and thanks for everybody for coming along and taking part as well, which was a really good discussion, I think. I think most people here, if not everybody, are well aware of the Zero COVID campaign. But if you're not, there are details on the chat of how you can contact us and get involved if you're not already involved. We've got a new website, which is really good. We've got we're producing a new flyer as well, which should be available on the website soon. So you can print that off and deliver it in your locality or whatever. Or through your trade union or Labour Party group or whatever. So there's various things people can do, and we have got to keep fighting, I think, haven't we? And we've got to keep at it and build that movement. And as John said, we're also fighting for the NHS as well. It's all part of the same piece, isn't it? You know, we've got the health and care bill going through Parliament at the moment. I think it's still in the House of Lords, isn't it? Which is just going to bring in an Americanized system really into the NHS, and we've seen how that has been creeping in over the last 10 years. And there is the day of action on the 26th, and the new SOS for the NHS campaign, which KONP and various other campaign groups are supporting, and really urge everybody to get involved with that if they're not already involved. Well, thanks again, everyone, and hope to see you soon. Keep campaigning. Cheers. Take care. Good night, everyone. And thanks again, John.